Good evening, everybody. Thank you for joining us this evening. I am absolutely delighted to introduce Emma, Amy, and Christina, who are going to be your hosts this evening. And we are going to be talking about preparation for practice. You'll have the opportunity to ask questions during and after the lecture. We have had some questions already in advance. I hope that you can hear and see me okay. So I would just be grateful if you could just put that in the chat that you can. Um, Perfect. That's great news. So I'm going to hand over. I'm going to be in the background for technical support. Any questions, could you put them in the Q&A box, please? Because that makes a real big difference for us to filter and answer them in the order that they come into. So have fun. I will see you all in about an hour and a half. Take care.
Thank you. Thank you, Sharon, and good evening, everybody, and welcome to this first Preparing for Practice webinar, number one of two. My name is Emma Slade Jones, and I am the Coaching and Mentoring Coordinator here at BSDHT. And even though Amy's not presenting tonight, I did also want to give a nod and include Amy because she's been really busy behind the scenes, just helping this presentation come to fruition. So yeah, as I say, if you have any questions as we go through, just pop them in the chat and there will be an opportunity at the end. We do have some questions that were sent in advance, which we can hopefully address through this as well. So this first part of the presentation of part one is really looking at CV and interview skills for dental hygienists and therapists. And this presentation is aimed at those that are just about to graduate, newly qualified, because some things will, still apply when you're newly qualified as well. So that will be the focus of today's session, and then the next one in a couple of weeks focuses on some other aspects as well, which I will cover at the end. So just a little bit about the toolkit. So this webinar is open to non-members. So if you are a non-member, you sadly will not have access to this. But for members, this Preparing for Practice toolkit can be found on the BSDHT website in the members area. If you log on and just search toolkit in the toolbar, in the search bar, sorry, you will find this. And this is what the information tonight and for the next session essentially is based on. Now, there's a lot to cover. And what I will say is we cannot go over everything. We cannot tell you absolutely everything, just because there are not enough hours in the day. But if there are common themes and there's things that you would like to go into in a bit more detail, you can let us know, and we can see what other information sessions that we can put on for you. But this is more of a signposting information session rather than, digging deep and going into things in too much detail. So this toolkit has been designed as a bit of a go-to manual. And again, I wish I could give credit to whoever it was that designed this. I think the previous student rep, Claire, was played quite a big part, and certainly past members of the exec team. As you can see, we're on to the fourth edition. So there's quite a lot of BSDHT representatives that have been involved in bringing this together. So thank you to those people. Okay, so just to start off then with when should I start applying for jobs? I've put now, which might be a little bit scary to some, but this obviously depends on when your graduation is due. So I'm just taking it that you've maybe got, May, June, July, 3 to 4 months potentially between now and graduation. Take it whatever timescale works for you. But just some steps to maybe start to thinking about is where you can search for some jobs and job openings. So, for example, you've got our professional organisations, us as BSDHT being one, BADT. There's job search engines, Monster, Indeed, Reed, NHS Jobs. Social media groups, there are quite a few. Again, some within your universities, you may have access to that. Start to network, reach out to dental practices either in your area or the area that you're hoping to settle in. See what careers fairs are around and about in that area, and let your tutors or mentors know that you're looking. Quite often it's word of mouth, certainly in my experience, that is what it's been. And start to prepare your CV and your cover letter, which highlight your skills, your clinical experience, and also your soft skills, your communication, and time management, things like that. You can start to prepare to register with the GDC if possible. Obviously, you need to get that certificate, that graduation, and that tick in the box. However, there are other documents that you can just start preparing in advance just to avoid any delays. So when the time comes, you're good to go and you've got all your documents there ready. From May to July, you can then start looking to apply for some jobs. Quite a few practices are open to hiring graduates. So I would apply, even if some of them ask for experience, I would say that you've got nothing to lose with this. The experience, may be beneficial, and it may just be that they can keep your CV on file, um, you know, just for future if anything does come up, even if you may not tick all the boxes at this moment in time. Start to attend some interviews, so be ready to discuss the skills, your case studies, what professional approach that you use. And also, we will be going into this in more detail in our next webinar, but consider employment versus self-employment. Start to do a bit of research around what it is that you would like, what type of job, what type of place that you would like to work at as a clinician. I'm sure that some of you have started doing that already, and some of you maybe, even have a background in dental nursing or in dentistry prior to this. So you may have a bit of an inkling as to where you would like to go. And then July or post graduation, as soon as you can, register with the GDC. If you haven't already done so, ensure that your application is submitted when you can. And then it's starting to negotiate contracts, hopefully as and when a job is offered, making sure that you understand the pay structure, any rates, self-employment terms, if applicable. But also remember to keep your CV up to date with your grades, with your qualifications as you go along, because it may be that you want to apply for several jobs at a time. Quite often, particularly in self-employed hygiene, there's, 1 or 2 days work available, and you can slowly start to build up from there. So where can you search? Part of the membership benefit for BSDHT is that we get some jobs sent out. There was a great one recently for the Falkland Islands, sadly a bit too far for me. But yeah, there's some really unique jobs that get posted via BSDHT. There's networking events. So at the moment, we've just got the spring meetings going on for regional groups. So there's the opportunity to do some networking there. And I think most regional groups have social media pages as well. So that could be worth looking at. Obviously, you've got like your search engines and your job searches. Like I said, Indeed, Monster, I think CV Library, things like that. Social media, again, there's lots of different groups that you can be part of. Quite often jobs get posted on there. NHS websites, NHS jobs, I think it is, and we just cover that coming up in a bit of in a few more slides time. Direct contact with a practice if you know of any, or even if you just want to drop your CV in, that is also another method. There are some dental recruitment agencies that you could register with to say that you're looking for a job, civil service jobs, and also Ministry of Defence are some areas that you could start looking at. And so some types of careers that you could consider. So the first one, I have included this because even though the date is a little bit tight for some and the date has passed for others, for the Dental Therapy Foundation training scheme, that potentially could be an option and it is open. I'll go through that on the next slide. So there's NHS, private specialist practice, hospital, community dental services, prison service, locum, Ministry of Defence, or the dream, go and work abroad somewhere. I can't advise you on that last one today, but if you do have questions on that, let me know and we can try and find out and get back to you. So for the foundation training scheme, this is included in the Preparing for Practice booklet with the contact details and the date that the application opens and sometimes when they close. So as you can see, there's some, the closing date was mid-February, some is April, some is May, some is March. If you're in that area and the closing date has happened, it's still maybe worth, dropping an email because you just don't know, what is going on and they might just keep your details on file if a space comes up. So I would definitely say if that's something you're interested in, contact these people for a bit more information. And so some questions that we had sent in advance that I just wanted to cover because it seems like this is a relevant part of the presentation to do this in was how do I get into community work? I'm not sure if it's true, but apparently it's quite hard. And then linking in with that, NHS work, how does it work now? What does it look like in the future? So what I will say is I don't have a crystal ball. I don't know what it looks like in the future. And depending on which part of NHS work whoever submitted this question means, it varies. It's difficult to say. But just to cover some things, so I had a look on the NHS jobs this morning, just typed in dental hygienist in the search. The majority that came up were MOD jobs, civil service jobs within the Ministry of Defence for dental hygienist. And then there's a selection of dental therapist roles. Some of these here depend on experience. Some have asked for a year's experience, others haven't stipulated how much experience. So again, go into the job description and have a look. But for NHS jobs, this is potentially where you would find for community practice and civil service or Ministry of Defence. If Because I'm not too sure when the person submitted this question if they were asking about NHS work within within practice. Um, you would need to have a personal number and a PIN. I believe this is the equivalent to what was a performer number, and I've kept that in and crossed it out because it's now referred to as a clinician number. And I believe that the system that this is on is called Compass. How it works is about splitting the UDA, so the unit of dental activity. What I would be mindful of is depending on which type of NHS job it is that you work in, if you worked in like a community job or a hospital job, NHS, there's a good chance that you will be employed and you would be entitled to employment benefits and pensions, etc. If you are working within a practice and opening a course of NHS treatment and doing it like that, then there's a good chance that you won't be entitled to those benefits. And I think this has been one of the bugbears, recently within our profession, that is there an expectation that hygienists and therapists take on this work without the benefits of pension, paid leave, that kind of thing. So just ask those questions depending on which role it is that you're going for. And I just wanted to invite my colleague Christina, if you're there, if you're able to unmute Christina, because
Hello.
Hello, Christina has just recently applied for an NHS job, albeit I believe a non-clinical role, Christina. But I just wondered if you're happy to share your experience of the application process, at least to just give a little bit of clarity on that, if that's okay.
Yeah, of course. So I recently applied for a non-clinical NHS job as oral health educator with King's College Hospital Trust. And unfortunately, I haven't started, so I can't tell you too much about it. Although I did do similar stuff back in New Zealand, so I assume it would be quite similar, working at school and care homes, trying to educate our public about the importance of oral health. So I did quite a lot of outreaching. So I've been just a little bit of background about me. I'm a dental hygienist and therapist, but currently not practicing as a therapist. Um, and I've been working for about 10, 12 years. And so I was trying to sort of see what else I could be doing. So sort of I was looking like non-clinical roles. So I did quite a lot of networking through LinkedIn
Hmm.
actually, and I think it's quite helpful if you know what kind of pathway that you want to go down to, you could look up, just type in the job titles and look up people that you might be able to connect with and send them a message. There's never any harm to send them a message to say, hi, I'm interested in, how you got to where you are in your career. Would you mind to have a chat with me? I really appreciate your time. And most, I've got quite a lot of success through that. And I got chatting with a couple of people who gave me quite a lot of advice. So anyway, I applied for this job when it came up on the NHS website, which is what Emma just shared. I
Hmm.
just kept my eye on it and then to see if there's any roles that would be suitable for me.
Hmm.
So when it came up, I went for it. It was quite a long process because there was quite a lot of hiccups. The job post got withdrawn a couple of times
Hmm.
because of their financial, like various reasons, I think.
Mm.
So it got drawn out quite long, but anyway, we got there. The job
Hmm.
got reposted. And I actually, even though the job was re withdrawn before, I actually got chatting with the manager anyway. So
Hmm.
I actually again kind of reached out to be like, hey, because they quite often have the names of the manager. And their email that you can actually
Mm.
get in touch with. So it's also a good idea to just send them an email and you might not you might not get a response, but you might. And
Hmm.
I did. So I actually got chatting with her and then kind of got my name out there. At
Mm.
least she kind of knows you. They kind of know you already. So then I got then she told me when the job got reposted,
Hmm.
actually. And I applied for it, and now I'm starting next month. Well, no, this month actually. Yeah.
Hmm.
Um, yeah, so the interview is quite, from my experience, is quite it will be quite systematic.
Hmm.
Um, in comparison to private sectors. So, I've only really had one NHS interview experience in the UK. So I can't probably tell you too much, but to me it was quite systematic. So they've got the questions they want to ask, and
Mm.
everyone will get asked the same questions. And whereas the private ones, quite often they're quite casual in my experiences. They're
Mm.
more like want to see who you are and like, want to have a chat to see if you're a good fit for the practice. Quite often they'll get you to have a clinical session. I've had it
Hmm.
happen quite like a couple of times where they want you to kind of work on somebody and see if you're, what they want.
Hmm.
So I guess that's the main differences. Yeah, so that's sort of my experience so far. I have had community work experience in New Zealand as well. If people want to know about that. And also working abroad. Obviously, I've worked in New Zealand, so
Hmm.
if anyone wants to know about that, maybe
That
I can tell you a little bit about it. Because I qualified in New Zealand, so I've experienced working abroad, which is here.
yeah, this is
Um,
your abroad.
yeah,
We need we need
so
a whole new webinar in itself about working in New
yeah,
Zealand, I think. It's such a beautiful
the whole
place.
process, yeah.
Yeah. No, thanks so much for sharing that, Christina. And can I ask roughly how long from start to finish, from application to starting the job, has it
Um,
been for you?
oh, I think I applied for the job in September actually.
Oh,
And
okay.
yeah, and then I got the interview I think in October, and then I got off the job not very long after the interview, like pretty much in a few days' time, they
Hmm.
told me about the result. And then the whole process started. So they go through a lot of checks, like identity check. Obviously, I'm on a visa, so they had to check that.
Hmm.
DVS, which I believe you will be going through later, Emma.
Yeah.
Yeah, so it kind of got drawn out quite a bit, but it's also because I was away for a bit
Hmm.
earlier this year. So and there was no way that I could start the role by Christmas last year. And I
Hmm.
was away for 5 weeks in January. So that kind of
Sure.
just delayed it. Um, but nonetheless, we're getting there.
Yeah.
Yeah. Yeah.
Oh, lovely. Well, hopefully we can catch up on your progress with that soon. But thanks so much for sharing your
No worries.
experience there.
No worries.
Again, just because sometimes, the NHS process seems like a little bit of a maze just to work through. But so it's really great to hear that you've just gone through that process and been successful with it. So thank you for sharing that. So yeah, I'm not going to read this out. It's just a statement with regards to how NHS approaches were changed with regards to adding them to the contractors and being able to carry out UDA's unit of dental activity. There is more information if you just put in Google the NHS Business Service Authority and how to register with a performer number. It brings this up, or personal ID as well, PIN number. There's this one, and I believe Health Education England, although I've heard that Keir Starmer's just closing those down, so I don't know how long that information's going to be there. But nonetheless, those are two places that you can just have a bit more of a read around this. And what I would say is, you can have a familiarization with this, but until you know how the practice works, this might not be relevant to you at all. Um, have these discussions with the practice when you go for interview as to how this will look like and work for you, and then it'll become a little bit more apparent. So I'm just going to pause there and say any questions. I can see that we do have some. Let me see this. I don't know if that's in the chat. So Q&A. Here we go. How can I make my CV strong for applying jobs abroad? Someone's saying. So we are just going to cover CVs now. I'll be really honest, I don't know the difference for abroad. I would make sure that you familiarize with wherever it is that you are aiming to be, but I will definitely go through some CV information there. And then somebody's put, I think I heard somewhere, but is it true that dental therapists working in the NHS don't get maternity and pension pay? So yes, that is true, depending on which type of NHS contract or not contract you are working on. So, for example, if you look at the NHS jobs that I've just shared with you on that website, chances are that that will be a employed role. If you are working within practice, that's a mixed practice, for example, and you do a mix of private and NHS work, then that is a contract that the NHS has with the practice, and you're not classed as an NHS employee. So, although you're doing NHS work, you don't get the benefits of being an NHS employee, like paid leave, maternity, pension, etc. And again, that's where some of the, frustration has come with the expectation of hygienists and therapists taking this on, to do our full scope of practice, but actually we don't get any of the benefits for it. So some people, quite rightly, have said, no, I'm not doing that. So that's fine. And then someone's put, please, could you explain a bit more about how working in practice as an NHS therapist would work, i.e., how would we get paid? How would we work, i.e., referral from a dentist? In a nutshell, no. I'm really sorry. There's so much potentially that there's so many factors to take into consideration with that. So I will cover it in a second. The best thing to do would be to get more information around that to then be able to make an informed decision and an informed answer. So I'm sorry that doesn't answer your question, but it's just too generic a question without further detail for us to be able to answer that. And somebody has then put, just to clarify, is that for mixed practice, not getting paid for maternity and pension? If you are self-employed, then no, you would not be expected to get paid for that. If you're employed, then there are certain benefits of being employed that you would get. Not necessarily pension, because it depends on how big the practice is, but you would be entitled to maternity leave and potentially statutory maternity pay for that. Can you please confirm if I work as dental hygiene in full NHS practice, will I get a benefit such as pension, maternity leave, etc.? Again, as if you're employed, then you might get that from the employer, but it potentially wouldn't be from NHS because the practice has a contract with the NHS. It's not for the NHS, if that makes sense. I know that it's a little bit tricky to get your head around with that. But these would be the questions that you would be looking to ask, I think, at interview. And then somebody else has put, what is the best way I can start preparing for interviews for these job roles? So wonderful. We shall move on to that now because that is coming up. And please keep your questions coming. Hopefully, I've been able to answer those all okay so far. But again, what I will say is if it's not and you've got more questions on this, please do let us know. And even if we can't answer tonight, we will try and get an answer. But as I say, there's just some questions that are just it's too varied. There's too many variables to consider that we just can't give you a straight answer on that without, further information. Okay, so moving on and looking at CVs then. So a well-structured standout CV is key. I say key for ensuring a role. Sometimes it hasn't been, and in my experience, some people haven't even asked to see a CV. I'm a bit of a dinosaur, though. I qualified in 2004. So, times were very, very different then. Sometimes practices just wanted to know, are you registered? Are you experienced? Great. When can you start? And that was as much as the conversation went. Times have changed an awful lot, and the job market can be competitive. So, having a real good, strong, standout CV will really set you apart when it comes to applying for jobs. And it's worth bearing in mind that this is quite often the first contact that the practice or the organisation will have with you as an applicant, so it needs to stand out. Employers and practice owners can look for your clinical experience, your skills in patient care, compliance with regulations. So your CV just provides a framework, on which they would base their decision. And so we're just going to touch on different types of CVs, some key skills that would be useful to cover, some structure and tips, and then some interview skills as well. And again, I'm not going into lots of depth with this because there are some more information in the Preparing for Practice toolkit, but also there's a lot of information online as well. So this is really just to give the basics of information of where to start. So just to explain what a CV is, I can never pronounce this. I do apologize. It's curriculum. Some people say vitae or curriculum vitae, but really what it translates to is course of life in English, which I didn't know until I was researching to do this presentation. So curriculum means the course or path, and vitae, a form of vita or vita, meaning life. And the purpose of the CV for prospective either employers or if you're self-employed, people that you would have a contract with, is to highlight your potential value. This is really your opportunity to sell yourself, to get your foot in the door, to get noticed. It then goes on to provide a framework for the interview to be guided. So whatever it is that you put in your CV can prompt some questions and talking points that would come up should you be hopefully invited for interview. So as a very, very basic structure, the CV should include the following things. Contact details. I know it sounds like a really basic thing, but sometimes people forget to put these on. So your name, email, phone number. Don't necessarily need an address. You can do, but a lot of things are online these days, so it's normally email and phone, but it's up to you. If you want, you can add a link to your LinkedIn profile on there. What I would say is make sure that that is up to date as well. Normally, you would have a personal profile, so a little bit about yourself, a summary of your skills and experience, just a short paragraph, and then any key skills that's relevant to the role or relevant to dental hygiene and therapy. A career history or work experience, so achievements in the current role that you're in or past roles that you're in, and then a list of your education qualifications, so your degrees, certificates, CPD, additional qualifications. For me personally, I put qualifications and training because there's sometimes training that is relevant, that's not necessarily a qualification as such, but it's relevant training. And you can also put some additional sections in there. So things like volunteering, your professional memberships. I have got my GDC and BSDHT number on there just so people can see that I've got professional membership with those. Now, there's different types of CVs that you can use depending on which type of job that it is that you want to go for, or depending if you have a career gap, experience. There's different formats. The two main ones that I would say are probably applicable in this stage would be the chronological CV, which is really useful for those with a really stable work history that don't have a lot of gaps in there, that haven't taken career breaks or anything. And that's where you start with, listing your jobs in reverse chronological order, starting with the most recent and working your way back. How far back you want to go. When I was looking at my CV, they said no more than 10 years. Did I really need to go back to when I left school? Was it relevant then? Probably not. So when I tidied mine up, I just went back for like the last 10 years, unless it was something that was key to the job that I was applying for. And then you've got your functional or your skills-based CV, which is best for people changing careers or those with employment gaps. And what that does is it looks at skills. It focuses on skills that you can meet the potential job that it is that you're applying for. And then you've got a bit of a combination CV. So then you've got your skills and experience in there. So depending on where you're at, it might be worth having a bit of a think now of which one is most applicable to you in there. Some key skills that you could consider to include would be clinical expertise. So, how do you work with guidelines, perio-restorative implants, patient education, pain management, infection control, digital dentistry. So what skills do you have with that? Teamwork, other things that come in are like timekeeping, time management, communication skills. Um, Again, there's lots of information on some of the job sites that have some really, really excellent example CVs. So I would say have a bit of a search around and see which ones fit best for you. But also have a look at the job description and then highlight what skills they're looking for. How can you demonstrate that you've met those and cross-reference as well? So some additional tips then for a strong CV. Keep it concise, 1 to 2 pages if possible. People don't want to be looking at lots. They just want short, sharp, here's the information. Tailor it to the job. So like I've said, if you've got a job advert there that you can use some of those keywords, use some of those themes and skills that are mentioned and show how you match those. Using action words like such as managed, delivered, implemented can be quite powerful. Really highlight your achievements, and if you can quantify them, and an example there is improved patient compliance by 30%. It may not be something that you're able to demonstrate, but if you've got something that's a bit of a solid example rather than just generic, that can be a bit more powerful as well. Use professional formatting, so clear fonts, bullet points, no excessive design or swirls. I mean, you might have some really great things on Canva if you're a whiz on that, but again, just keep it, professional looking. First impressions count, so be brief and be clear. And then for graduates, I would say emphasize the skills and experience along with any of your academic achievements that you have there. If you're responding to a job advert, understand the job advert itself. How is the job described? Do your research on the practice, company, or organization. So, as and when the time comes that you go for interview, the chances are, you can find out an awful lot about the practice, where it is, have they got a price list there already? What sort of patients do they treat? What treatments do they offer? Who are the staff? Stalk it as much as you need to. Do your research on that practice or organization. As Christina was just saying, then, contact to request further information if needed. So certainly when it's on NHS jobs or civil service jobs, as an example, it has a main contact and an email for that person. So there's no harm in just dropping them a line to say, can you give me a little bit more information on this? Or I'm interested in applying for the role. And if you've got any questions. And then it's useful to adapt your CV with that in mind. So you would probably look to have a generic CV, with everything on it. And then what you can do is tailor it to that job, that particular job in mind. And when I say adapt and tailor it, I mean adapt and tailor it, not make anything up or put anything in there that's not correct and not accurate. I definitely would avoid that. You will get found out at some point. So keep it factual, keep it honest. Don't elaborate more than it is. It's just not worth it, basically. Some mistakes then that people can make with CVs is underselling yourself. Just not having enough information about what it is that you do, or not really celebrating the wins and the successes that you've had. So I would always give it to other people to read over. Some places have a CV check-in service as well. There's some charities that do this for free, so it's worth just having a bit of a look around. Hopefully, if you're, still at university, they may have that student service support that they're able to do that there, but have a bit of an ask around. If it's poorly laid out, if it jumps all over the place or it's too much, crammed onto 2 pages, if you haven't checked the spelling and grammar, again, attention to detail. This is me, too long and wordy with insufficient information. I really had to work to thin my CV down because I just included everything on there. And I do still have a version that's got everything on there. I can then tailor it and remove things for particular roles. There's some different schools of thought on this, but it's kind of considered in this day and age that you don't really need to add your date of birth, whether you're married or not, age, gender, religion, anything like that, unless it's relevant to the job. I can't see that it would be relevant to jobs at this time. I did actually read a book in the library that was published in 2023, and it was advising that we add all these things in. And I just think, in this age of inclusivity and diversity, it's not really a requirement. So for me personally, I wouldn't add any of those things in unless, there is something in the job description that would lead, you to having to disclose that, which I can't see, but is just worth mentioning. Just be mindful of putting anything on them with regards to that could put you at risk of things like identity fraud. So things like your national insurance number, your passport number. Make sure when you've got your LinkedIn profile that it's your security settings are, relevant for who you want to share that with. CVs can be shared across, multiple platforms. We always hear about identity theft and things like that. So it's just something that I wanted to touch on in this presentation. Again, if you've got content that's just too generic and it doesn't really focus on anything particular, and then there's the overuse of buzzwords. I've lost count of the amount of times that I've seen. I'm a confident, motivated, with a proven track record of forward thinking, like those sort of buzzwords. It doesn't tell you anything about you as a person. So just be mindful of using a CV template that says these things. Try and reword it so it gives the character of you, of who you are. Some other frequently asked questions, and should it include references? For me personally, I just put references available on request and I don't name anyone in particular. The chances are that those references would not be contacted before you're offered a job, as and when you are offered the job. And if references are required, they would then ask you to provide those references, and you can give your nominated referees the heads up that someone will be contacting them. So I would say that it's not particularly relevant. You can if you want, but I would just put references on request. I've put in there health questions because for some, obviously for jobs, working clinically, the requirement is to have, up-to-date vaccinations. At one point it was evidence of COVID jabs. Hopefully that's long gone, but nonetheless. So that does come up. Should I include this, in my CV? For me personally, I would just put full vaccination record available on request because potentially it is something that you would have to share. With your workplace anyway. Salary details, what you are currently earning or what your expectations are, I wouldn't put in. That's something that can be negotiated either at interview or on acceptance of a job. LinkedIn profile. So again, by all means, I would say put the link on there, but just make sure that it's up to date and it's kept current if you're going to add that to your CV. Do you add a photo on there? I personally don't with mine just because I've got a face for the radio, so I don't put a picture on mine. Some people do. What I would say is keep it professional. I did work at a practice once where they were looking to replace myself because I was moving on, and we had a load of CVs, and I loved it to be honest. But she had a picture on there, and she had like a Hawaiian garland on, and it looked like she was at a summer barbecue with a margarita in her hand, and I was a bit like, oh. Don't know how professional that looks. Looked like she was having a great time, but maybe not applicable for a CV. And then cold calling practices. And what I mean by that is it okay to just drop your CV into local practices? I would say yes. You can either email them or you can go in person with a printout and just drop it off. It's whatever works for you if you want to do that. Sometimes it's nice to go into the practice and get a bit of a feel for the place and say, look, is it okay to just drop this in with the practice manager? I'll be looking for work. I'm due to graduate soon, and here's my CV. Some people don't feel comfortable doing that, and that's absolutely fine as well. I've done it in the past. It's worked for me when I've known openings have been coming up. And also, it means that the dental practice don't have to pay for recruitment, advertising, and fees if they've got, a bunch of CVs that they could look at. So that's that. Onto a cover letter. This normally would accompany a CV as well. So it introduces you to I say employer, I'm using that term, but it could be practice as well, because potentially, you could be self-employed. And it just asks them to think about your application. It's just a short letter, about 3 to 5 paragraphs, that accompanies your CV. And again, making sure that this is professionally written, a little bit about yourself would just get you noticed. So things to consider to put in a cover letter along with your CV would be an introductory paragraph. So explaining who you are, a bit about yourself, why it is you're writing, what you're looking for. The second paragraph, why you're interested in working for the organisation. Paragraph 3, what makes you a strong candidate for the job? So what are your skills? What can you bring? What can you offer? And then conclude on a positive note. You can include some practical details saying available from, particularly if you're due to graduate, or anything like that. But I would definitely always have a cover letter in with your CV, whether that's email or you're dropping a hard copy off anywhere. And actually, these things can be quite useful because even if a job comes up that you have to then apply online, it's normally a case of cut and paste and maybe expanding on that information. So it's already there if you need to do a personal statement. So as I was just saying, sometimes you don't get the option to send a CV, and it might be a job application form that's part of the company process. So research the job and the company. So understand the role, the skills that are required. What is the culture of the company? What are the requirements? Where it says here, gather your information, so your work history, qualification, skills, that is what part of building your CV will hopefully do, and that's what it's about. So you'll have that good to go. I would say tailor your answers. So, as I said before, with regards to the job description, provide specific examples. Look at the job description. Where do you meet those things that it's asking for? Be clear and concise. Stick to the word limits that are used. If you can say it in 100 words rather than 500, that's even better. You can use things like AI these days, ChatGPT, just to refine some of the things that you want to say, but make sure that it's you and your words. You don't want it sounding like, a generic, even though some of the job adverts sadly do sound like they've been written by AI and are quite generic. So yeah, just be mindful of that as well. I've put about using the STAR method for structured responses, and I'll come on to the STAR method in a bit. Writing a strong personal statement, so highlight your experience, your enthusiasm and value. So really your personal statement is a summary of all the key points that you would put in your job application form. That's a really powerful paragraph or a section of writing that just sells yourself. Definitely proofread, check for spelling, grammar, and clarity. I had an email today that I've been going back and forth with somebody since November, and in the title is a spelling error, and I've only just picked up on that now because I've just been looking to and from back and forth. So get other people to read it, reread it, and read it again. One of the problems that I have, I don't know about anybody else, is the Americanization of spelling sometimes, depending on what setting you've got on your computer. So sometimes it may do a spell check with American examples. Not that it's a big thing, but again, just sometimes attention to detail. And then just follow up if you can with an email or confirm receipt and just prepare for the next steps because normally it would have a closing date on it. So, just to be mindful of when can I expect to hear about this. I'm going to pause right there because I'm sure you're tired of hearing my voice at the moment, and I'm just going to have a look at some questions. So we've got some in there. Do you think we should still apply for jobs even if you're wanting to do the foundation scheme for first choice? I'm going to open that to Christina and Amy. My answer would be yes, because I think you haven't got anything to lose by going through the process, having a plan B and having a backup. So for me, I wouldn't apply for the job if I didn't want it because it's quite time consuming. It can take quite a lot of energy. And if I had no real desire to have that job, I probably wouldn't apply. But if it was something that I was interested in, I would look to do that because again, you just never know. It's keeping your options open for me, I would say. Um, Christina, I'm going to go over to you. What would your feedback on that be?
I think I'm pretty much the same as you, Emma. I think if it's a job that you want, I would say go for it because you just never know. And I think it's an overall a good experience anyway.
Hmm.
To if you do get through to interview and all that. So I would say yes.
Yeah, yeah,
Yeah.
same. Amy, how about you?
Yeah, I totally agree with both of you. I think all of it's experience. You've always got backup. It's always good to have backup. It's also good to have the connections with that practice as well. So maybe then if you get on the foundation scheme, the vocational training scheme, then it's and then after that's finished, then you've still already got that connection with that practice. So I definitely would, yeah, still keep your eye on the ball for jobs, apply to them. I think, yeah, if it's like Emma said, that it is time consuming. So if it's one you want to go for, but I'd also keep options open, and maybe some jobs that I wasn't 100% sure about, I'd still maybe go along for the interview and see how I feel,
Hmm.
because sometimes it can surprise you. Also, or any interview that you have is good experience for the jobs that you really want. So
Yeah.
yeah, absolutely.
Yeah, definitely. And again, I think you've really summed it up there, Amy, that if you're successful for the job, but actually it turns out that you don't need it, it's a real confidence boost as well to know that you have been offered that job and you can. If you're not successful, then ask for feedback, and that feedback is always really, really valuable as well. And I'd say nothing is lost apart from your time and energy. So just be mindful of where you want to spend that. Do you recommend creating a LinkedIn profile? I'll be honest, I've got a LinkedIn profile, but it's only really because to network with the job that I'm in at the moment. I've not used it for job searches. I know other people that have, and Christina, you've just said that you use that. Um, so I would say it's really personal preference as to how much you're comfortable with doing that. Amy, how about you?
I think it's definitely something good to have. Just actually being here tonight is making me think I should probably go and update mine. I think in our industry and then like general practice and dentistry, if that sort of the route that you're mainly taking, that you're going to be mainly working in general practice. I don't know how well LinkedIn is used, but certainly in other industries. Also, if you want to get into NHS roles, or any sort of lecturing roles one day, I think LinkedIn will be used a lot more in those networks.
Hmm.
So sort of further opportunities. So I think it is good to have one. How much they're used in general practice. I've worked predominantly in general practice for the last 13 years, and I don't think anybody's asked me about my LinkedIn in that time. But
Hmm.
then when I've gone on now in my career and done other roles, non-clinical roles, then it's used a bit more.
Perfect. So Christina, you said that you've done some networking on LinkedIn.
Yeah. I only got LinkedIn when I moved to London, I think, about 6 years ago, to be honest. It's not really a thing in New Zealand. I don't know, maybe just a bit too small for that. Or it's just not really a thing in the world of dentistry. But I agree with Amy, like if you predominantly are going to be working in sort of general private practices, they don't really look at it in this industry. But I did find it really helpful when I wanted to branch out into non-clinical roles and
Hmm.
just network a little bit on there. And then, you'd be surprised. You can get quite a bit out of it. And so I would say yes, it's no harm having one. I have to be honest, I'm not very active on it.
Mm,
Uh,
same.
but yeah, I do have one. Yeah.
Yeah, and I think it depends what industry you're in as well, because
Yeah.
some industries are very, very active on LinkedIn. I've got some colleagues that are, I work in coaching now and in an education sector, and there's quite a lot of activity within the education sector on LinkedIn. Not so much, self-employed or clinical jobs, but they still may be there. They still get posted. So, um, I would say it's personal preference, but if you do decide to do it, just make sure it's up to date if that's what you're sharing. Someone else has put on there, would you recommend adding previous dental experience to a CV? Absolutely. If it's relevant, if it's a dental job, I would say yes. Um, if it's not and it's a different type of job that you're going for, as an example, so I sidestepped away from dentistry 3 years ago to work in an education role, but I did talk about my experience within dental education. With that, I didn't mention my past as a dental nurse because it just really wasn't relevant to the job at that time. But absolutely, if you go into work in practice, then yes. Oh, in fact, Amy, I've got Amy. You would like to answer this question, so please do.
Yeah, I think especially as you just for those students that are graduating now, I think get all of the experience that you've had on your CV. I mean, us guys have all been qualified now over 10 years. So we're gonna have more things to put on there. But if you've been doing got dental nurse experience and then gone to university, I think that's a great thing to have on your CV. Practices will like to see that. So and it's also things that you put on your CV are good talking points at interview as well, especially if you're quite new to interviews. You haven't had so many. You're gonna be a little bit nervous, and it's quite good to have those prompts on there as well. You can always have a look yourself. I normally take a hard copy of my CV with me, so I've got that paper copy in front of me. So if I do need any prompts, that's there as well.
Hmm. Perfect. Just conscious of time. How many jobs should we apply for at the moment? How much is too much or not enough? It depends where you are, I think, and how much energy you want to give to them, where the area is, how competitive it is. I don't know, Christina, Amy.
I'd apply for anything that I've wanted, to be honest. So I just have a look at it. Get if you've got that many job opportunities near you, there's no harm, and you like all of them. They all meet the sort of standards that you want to work in. Then there's no harm in applying.
Hmm.
Yeah, I think it depends on how demanding the job application process is and how much you want it. So like Emma mentioned before about dropping in the practices and just kind of drop it. It's not exactly applying for the job, but that's something that you can do quite easily if you want to. I've done it in the past plenty of times, and I think it's quite a good thing to do. But I think it just depends. If I think the important thing is not to stretch yourself too thin.
Hmm.
It's just sort of see, if you want to, then apply for them, but don't get too overwhelmed by it.
Hmm.
Yeah.
Lovely. I'm just conscious of time, so I'm just going to continue with the presentation and then hopefully come back and we'll get as many of those questions answered as possible, if that's okay. Um, So, interview preparation, then, as I touched on before, I would say definitely research the practice, the clinic, or the corporate, before the interview. Make sure you know as much as you possibly can. Be prepared to discuss your skills, experience, your approach to patient care. Have some examples ready, for common interview questions. Somebody has just posted, and I did see on the chat about case studies. So, again, this could be a really good example where you could bring these up. Dress professionally and maintain, positive body language as well. Your CV, it won't get you the job, but it definitely will get your foot in the door. And so the way that I see it is, they like you. If you've been, there's something within your CV that they like. You've been invited for interview. There's no reason why the job can't be yours. You just need to confirm it then with the interview. And I think what's really important is to be mindful that the interviewer controls the structure. So whoever is interviewing you, they have got the structure of the interview, but you control the content. You control what you share about you. So again, planning some questions, planning some answers, being mindful of that can really just help you feel at ease when you go for interviews. Simple, practical things. I would say do a dry run, plan your route. This is if it's in person, obviously some are online, but if it's within a practice, I would want to go to that practice and see the practice. It depends. Some might be a two-part interview, so you may have an online element. Check your tech, make sure that you've got all the correct links, turn your phones off so that you haven't got distractions. If it's going to a practice, do the run when it's at rush hour, because if that's what you're going to be doing, you want a real life feel. Do the journey as you would do it if the job is yours. Check the traffic, check the, travel, all that kind of stuff. Just, practical tips, be prepared for that. And make sure you give yourself plenty of time. Turn up early if you can. I'm not going to go into this in too much detail because it's infinite, but there's some common interview questions. Classic one is tell me a little bit about yourself. So be prepared. It's really difficult to be put on the spot and it's like, how much do you want to know? Like, oh, I've got my level 3 ice skating qualification. Like, is it relevant? So just be mindful to keep it relevant to the job. A little bit about you as a person. They obviously want a bit about your personality as well. But just make sure that you don't go off down a rabbit hole and waffle on too much. Why do you want to work at this practice or, for this organization? How do you handle nervous patients? Some other ones are, describe a time that you worked in a team. How do you approach teamwork? How do you stay up to date with dental regulations, particularly, with changes that have come in recently? Other ones could be, how do you manage a difficult patient? How do you manage conflict, within the workplace? And if you can't give a specific example because, you are newly graduating, think of a time when you have managed a conflict that would be relevant to showcase how you've managed that. The STAR method for answering questions is a really a really common structure to follow, where you have the situation, the task, the action, and then the result. So describing the context of the experience, what was the challenge that you faced, what steps did you take to address that situation, and what were the positive outcomes of your actions. So it may be worth trying to think of some examples for certain situations, just so you've not too on the spot at the interview. For an example that I've got here is handling a nervous patient. So tell me about a time when you managed a nervous patient. You could say, well, I had Mrs. Smith, patient with, severe dental anxiety. She was really reluctant to have any treatment. My goal was to reassure them, complete their hygiene treatment successfully, get them used to local anesthetic where previously they just wanted, sedation, for example. What I did for that is to use calm communication, that I would explain things to them, each step clearly, offered short breaks, etc., etc. The result was this patient, was now a lot more confident and relaxed and booked follow-up sessions with no issue. So just that STAR example there is quite a useful structure to really stop you from disappearing off down a rabbit hole, keeping things concise but relevant as well to the point. So as I've just said, practice some answering questions using the STAR method. For me, I wrote loads down, I put them on like post-it notes just so I had them dotted around so I could really familiarize myself with them. Have some questions to ask. If you go to an interview and you don't have any questions to ask, I would say you have not prepared. It's very, very rare that all of your questions would be answered. So definitely have a bank there. If they say, do you have any questions? And you go, no. As an interviewer, I would think, how interested is this person in this job? So maybe just think of a list of questions that you could ask. It's really difficult as well because you are in the moment and you are on the spot. So even if you just say, look, I have got a list, do you mind if I just have a quick look to make sure that that's answered? Just as I've touched on before, arrive on time, make sure you're well prepared, you've got a positive attitude, and follow it up with just a thank you email after the interview and look forward to hearing from you. Sometimes, unfortunately, you don't get feedback and you have to chase them if you don't hear anything. It works both ways. The way that I see it is, as long as I feel I've done my bit and I've been professional, if the other side haven't, that's down to them and it's not really great business and would I have wanted to have worked there anyway. But I think manners cost nothing and it's just useful to follow that up. Even if it's been unsuccessful, you could ask for feedback and say, please let me know if there's an opportunity in future. So, some questions that you should be asking, and again, there are quite a lot here, just because our role is so varied and the nature of the jobs can be so varied. Sounds really simple. Is it a Hyde role? Is it a therapy role? Is it both? Because when I've seen some adverts, particularly on Indeed, that are maybe written by AI, it just doesn't make sense. So even if you just have a phone call before applying and wasting time, can I just clarify what is this role for? Is there nurse support? So I did post on social media, what are the questions you should be asking? This one came up more than any of them, I think, just because of the pressures that we are facing as as DCPs, as hygienists, as therapists, for the expectation that we will work alone. More and more people now are refusing to. I would say it's up to you how you want to work, if you work with a nurse or if you choose not to, that's entirely your call to do that. But changes will only be made in this profession if we all make a stand and start asking these questions. And if you're in a position to say thank you, but no thank you, I would like to be supported in practice. At the very least, ask what decon support is available. Things like white space, is it paid for? Which leads on to, is it percentage or hourly? What instruments or equipment are available? Can they order you more in? Do you have to provide your own? Can you create your own treatment plans, set your own appointment lengths? What is the standard appointments at the moment that they offer? Can you do a trial day or a trial session, morning or afternoon? And how are you going to be remunerated for that? You're not expected to work for free, particularly if they're charging patients. So that's just something to bear in mind. I've touched on appointment lengths and percentage or hourly. Do they have a full diary, or is this a new position? Can you have a look at the diary and see? That will give you a bit of an example. Even if you're not clicking on there, because obviously there's patient confidentiality, but just, from a little bit of a distance, are there gaps? Is there anything that's, any red flags that when you look at that diary, when they go, yeah, we're fully booked, we can't wait for you to start, and then actually there's loads of gaps that you're not going to be paid for. So just be mindful of that. Asking what the treatment protocols are, particularly with perio. How does it work with, dentists seeing patients? Do they refer? Is it direct access? Having a chat with other team members, particularly, other hygienists or therapists that work in the practice. And a bit of an optional one. Why did the last person leave? Why has this role become available? I would now, in this day and age, always put something, if I can, on social media, that I'm looking for a job in this area. Does anyone have any practices to avoid? Please, could you private message me on that, because there are some horror stories out there. So if you can, do a bit of networking to find that out. It's always worth considering. Obviously, people leave for different reasons and it can be hearsay. You need to get a feel for the place as well, but it's always worth knowing, why the last person left, if possible. There are some more questions on page 24 of the Preparing for Practice toolkit. So I'm not going to go into any more of those questions because, again, that's a webinar in itself. But remember, you're interviewing the practice too. It's not just about, are you good enough for them? Are they good enough for you? And I think really have that in your mind when you go into that practice. Is you're interviewing them as much as they are interviewing you. Ask to have a look around. Ask if you can shadow, if possible. Some, hygienists and therapists might not be comfortable with that. I've always done that before I've taken a job, and no one's ever had an issue. I've maybe just nursed for them, or just sat monitoring, obviously asking patients if that's okay, just to see, how the clinic runs, how it works. Things like, is it possible to have mentoring? Is that something that they offer? Is it private or NHS? Plan patients. Can you use your full scope of practice there? If not, is there an option to, increase that as you settle in? What are the expectations of pay, hourly percentage? We will cover this more in the next webinar there, which links in with, employed, self-employment. What are the treatment charges? So I generally would go on, how much does that practice make an hour from their hygiene or therapy on average? It might be difficult to say, depending on the variety of treatments. For hygiene, it's pretty standard. It might be a bit different for therapy. I'm a hygienist, so I can only relate to that. And what is their failure to attend or they do not attend policy for patients? Do they charge them? Does that charge get passed on to you? Are you left with a gap that you're then not paid for? If the patient's on a plan, they've still paid that plan money. Do you get a percentage of that? So these are just some of the questions to bear in mind because it's quite often not until you start in that role that, these things become apparent. So it's useful to just have these in mind. And what I will say is, it comes down to, I really like when I was reading Tim Peake's book and listening to some questions about Tim Peake, the British astronaut, and he said after that whole selection process that he went through for years and years and years to get into space, for however long it took, for however long the selection process was, what it boiled down to at the end was, can I spend 6 months in space with that person? You could have been amazing at, the rocket science type stuff, aviation stuff, but can you get on with a team? And really, that's, what it boils down to in a lot of jobs and in a lot of roles. So, how do you fit in with that team? What is that team culture like? Personally, I have left jobs because I don't feel like I fit in. I don't like that team culture. It's not where I want to work. You obviously don't know that at the time, when you go for interview, but that's where, just getting a bit of a feel for the place can help you make that bit more of an informed decision. Quickly on to GDC registration now, because I'm just conscious we've got some questions to answer here. So there's two different routes. The route depends whether or not you've got like existing DCP registration. So you may already be registered as a dental nurse. You will need a computer and a printer because you'll need to print out that application form, and so the full application isn't completed online. There's more information on this again in the Preparing for Practice, and your university should assist you with doing this as well. There are a checklist of supporting documents, so it's really worth making sure that you've got these. So the minute you can, you're good to go and get that GDC application in. Make sure that your application matches with your university. Check it for errors, things like name, all that kind of stuff. These little things can really just hold it up. So you definitely need a proof of ID, a certified original passport photo, evidence of your qualification as soon as that comes through, and any evidence of name change if you need that as well. So how long does it take for registration to be completed? So I looked on the GDC website and it says if we have all the documents requested, it should take up to 10 working days to assess your application. It doesn't say any more than that. So I think look at the key is in the detail. It says to assess your application. It doesn't say how long it will take to come through. So when it says 10 working days, that for me is more the reality. When it depends what they've got on, obviously, but some years people have waited weeks, some it's been months. It may just be worth planning for it to take potentially 2 to 3 months, but following that up if there's a bit of a backlog there. It's difficult to say because again, some years it's taken longer than others, and some people have had it through quite quickly, others haven't. But yeah, be prepared that there may just be a little bit of a wait on that. How much does GDC registration cost? So again, in our Preparing for Practice manual, I do need to update this because when I checked on the GDC website today, it says the GDC registration fee is £36.33. What it actually is now, it's a scale, it's a rolling fee. So depending on the month that you are registered or that your application goes in, it depends how close that is to the annual retention fee date. So annual retention fee is something that we pay every July. If you can, I would say set up a direct debit for that so it comes out, and make sure that you've got enough money, because if you don't pay that, you can be struck off the register, and it's really easy to just miss that and life to get in the way. So make a note on your calendar, pop-ups work, set up a direct debit so that that comes out. I think I'm not too sure, Christina or Amy, can you pay in installments now for GDC registration?
Not actually sure, to be honest.
No.
Me either, but I don't think so. But
About
I'm not sure.
104. Is it £114 a year now?
Well, it's reduced. It was that, and then it was near on £120, and it's now gone down to 90. Oh, in
Yeah.
fact, no, there you go. It might be.
Oh, it's on there now.
£8, so 104. So yeah, £96 it is. So yeah, if you
Yeah, I'm
register in
not
July,
sure to
it's
be honest.
£8 registration plus your annual retention fee for that. If you are already registered as a dental nurse and you want additional titles to add, then it's that £36.33. But I would just query that it may have changed because you don't need to pay any additional annual retention fee or a registration fee because you're already registered as a dental nurse on there. Or it could be that you're a registered hygienist and then you're adding therapy to your title. But yeah, you should hopefully have guidance on that from your university. DBS checks. So I should have amended this to enhanced DBS, so disclosure and barring service. So this used to be CRB, Criminal Records Bureau. So if you have a criminal record, this is where the checks are done. And all clinical dental staff require this. It's part of the requirements. In England and Wales, it's DBS or enhanced DBS because you'll probably be working with minors, so under 18s, and vulnerable adults as well. In Scotland, I believe it's Disclosure Scotland that you would apply to. Um, it can be quite quick at coming through for a DBS check. Certainly mine have been. I've got nothing on mine to question, so it has come through quite quickly. You get the certificate, and then the employer, or if you're self-employed, they will ask to see that. A good top tip is to take a copy of this and email it to yourself so you've got these files online somewhere that if you need to share it at short notice, you can, just forward that in an email. So have a copy of your certificates, your indemnity, DBS, all the rest of it. Just have it in a file somewhere that's easy to access or in a draft email that's good to go if you needed to share that. When you get your DBS, within 28 days of getting that, you can register for the update service, which is £16 a year. It used to be 13, so it's not gone up that much in, the last sort of 8, 9 years, I think, since I last looked at that. But it does make sure that your DBS is always up to date, and it really it is quicker because if you work across multiple practices as well, you could just provide your number, they can check the update service. If you do things like extracurricular activities, I know that sometimes for things like scout groups, brownie groups, volunteer roles, you're required to have this. And it's made it really easy that I've just been able to say, look, I'm on the update service, here it is. Normally, the workplace would maybe apply on your behalf to get this, and you would then have to pay it. Or potentially, if it's an employed role, they would pay that. But if you're self-employed, they might just pass that fee on to you. Otherwise, I was just looking at Cavity DBS that they're called there. They can do it on your behalf as well. So if you're self-employed and struggling for somewhere to do that, then it can be there. Indemnity is also something that you'd need to be looking at. And obviously, there are other indemnifiers available, but just to touch on the one that BSDHT is linked with is AllMed Pro. They do offer support. They have legal costs. I think they're quite competitive. They haven't put the fees up for things like additional duties and direct access and things like that when it came in. But what I would say is do shop around. I know that AllMed Pro, they have an exclusive access to BSDHT members, so it is worth looking at that if you are a BSDHT member. But yeah, again, do some shopping around. And it's a bit like your car insurance. If you drive, you check it from year after year. But I've heard good things about AllMed Pro. I'm not personally with them. I'm not practicing anymore. But I have, spoke to the people that are involved in that, and they are, really supportive of hygienists and therapists. So some questions that we've received so far, I appreciate there's quite a few questions as well, so we'll try and get through as much of those as possible. So being paid per UDA versus per hour, what is better? And I put the diagram on there of a piece of string because how long is a piece of string? It's really difficult to answer this. There's a lot of considerations that you need to take into account before making this decision. So if it's an hourly rate, do you want a guaranteed income of an hourly rate? You'd really need to do the maths. You'd need to know what the UDA rate is, so unit of dental activity. That's with working with NHS. How are these allocated? Yeah, again, it's a whole different webinar in itself. Work it out. I think have that conversation with the practice, get the figures, and then you would need all of that support and information to make that choice. It's too much of a general question to be able to fully answer. So I apologize about that, but that would be my advice is to ask the practice. Um, are there any courses that we can do to enhance our understanding of treatment planning? Again, it was a little bit of a generic question here, so I'm not too sure with regards to what treatment. I wasn't too sure if it was like perio, restorative, if it was a in-person one that you would like to attend, or if it's an online one as a refresher. So I did a bit of asking around Ian Dunn, and I think it's Action. I think that's how you pronounce it. I'm never sure, but they do have like a hands-on perio treatment course that covers treatment planning for perio. Kat Edney does a lot with dental therapy. There's quite a few perio masterclasses that are on offer out there that cover treatment planning for that. There are some online ones with Health Education England and Max course, which you can go on. Dentsply, when I Googled it today, treatment planning for DCPs, Dentsply came up. I think there's one in June. Enamel Academy, I've not heard of these, but when I looked, it did say, CPD, like verifiable courses, but it's aimed at those that are doing the ORE exam, so overseas registrant exam is to prepare those. But it didn't say that it wasn't open to everybody else. It did say DCPs as well, so that could be an option for treatment planning. If that hasn't answered your question and it is more specific, please, do let us know, and we may not get round to it tonight, but we'll try and get back to you as soon as possible. What is a good salary for a newly qualified hygienist and therapist? I've put a ball of string there again because again, there's far too many considerations just to take into account. So what are the patient charges? How long are the appointment lengths? What is it? What part of the country is it? Central London would really, really differ from North Wales, for example, or somewhere more rural. Is it private, NHS, plan, mixed? Is it hourly, percentage, employed, self-employed? Do they provide equipment? What is provided? What other support is offered? Do you get mentoring as part of that? Do you get any CPD paid for as part of that? There's just too much to consider. So what I would say is when you get this information, then I would say, is this a good wage for these circumstances? Again, you've got regional groups that you can reach out to for that to know roughly what's going on in your area. If you don't have that, you can email us at BSDHT, and if you remember, we can, try and look at the relevant people within those regions to say, yes, this is what I would be looking at. This is fair. Or maybe you might want to consider this because sometimes, a low wage may seem low to some people, but if you've got, paid leave, pension, training, all those kind of things, actually it's favorable to some people. So here are some useful websites for CV and interview prep. So National Career Service, Reed for careers advice. If you just pop these in Google, they come up. Interview techniques, CV. I've always found reed.co.uk quite good. Staffordshire University, just because that was where I did my non-dental degree, but they have got a depository of lots of useful information, and then potentially your own university websites and support services would have those as well. I did just also want to mention that before, just after our next webinar, so the part 2 of this is happening on the 16th of April. There is this one that's happening on the 17th. If you did want to register, it's open to all BSDHT members. And although it says from payslip to pension, it's really worth looking at as you start your career of managing, and planning for your retirement. What is it that you need to be looking at? It might seem like really early days at this moment in time, but I think if you can get this information now, even if you're not in a position to pay into a pension or it's just really useful, that's free with information. I would encourage you to go just to, if you've got any questions on that as well. If you remember, you should have had an email about this, or just check the socials or email inquiries if you wanted the link for that. Part 2 of our webinar will be on the 16th of April, same time, same place. So in that one, we will be discussing employment versus self-employment. financial considerations, IR35, what does that mean? Sole trader and limited company, self-employed contracts, and tax and national insurance. So if you do have any questions on that, I may not answer them in this one. I may look to just put it towards that one, just because it's more relevant. Or if you once we've finished on this, you have any questions between now and then, Sharon will be sending that out, and Amy will be sharing that in the student rooms as well. Lastly, just to go into BSDHT membership, as I say, some people on this webinar may not be BSDHT members, which is absolutely fine. But this is why we opened this webinar to non-members as well, to just showcase some of the benefits and information that are available to you. One of the main things is the legal helpline, which people have said is absolutely invaluable. And then you've also got potentially some legal costs as well, if it's deemed appropriate to take it further forward. You've got support, advice, career guidance. We do, webinars quite often, CPD, training courses, lots of regional events. You get your publications, including the Dental Health Journal, BSDHT Bites emails. We've got, I say, a vast library of member-only content. That is just because we've switched to a new website. So some of that is still a work in progress, but is definitely coming in the next few months. I'm part of the coaching and mentoring program, as is Christina. And you can get up to 6 sessions of coaching and mentoring to support, as part of your membership. Membership is free for students, and for newly qualified, it's £66 a year, which, if I did the maths correctly, it works out to be about £5.50 a month. And when I looked at what you can get for £5.50, it was a Tesco meal deal, or 2 pouches of dog food for £5.50 from Ocado. So there you go. It's worth it. Here's the QR code if you wanted to scan and find out more for that. So I'll just leave that on screen for a second while we go through some questions. Again, just a bit conscious of time. Christina, Amy, is there anything that you feel that you would like to add at this time? We've got around about 10 minutes left. I feel like Martin Lewis, when he does his money show and he goes through like as many questions as once. But is there anything that you would like to add?
Oh, Emma, it's been great. I think, sorry, Christina.
No, Rita.
Yeah, it's been great, really informative. I think everybody's listening is going to agree with that. I just did look up the GDC. A few people have asked about can you pay in instalments? You can. It's 4 instalments over the year of £24. So there is that option as well. But yeah, I'll carry on with Christina.
I think Emma pretty much covered it all, but I think a few things I want to mention is when you apply for a job, really know what your deal breaker is. I think that's really helpful.
Yeah.
So, for example, for myself, at this stage of my career, my deal breaker would be half an hour back-to-back appointments without any nursing support. Is to me, that's a no. So I think it's helpful to know what you cannot compromise on and what are the things that you are willing to compromise on, before you sort of go into the job interview. Another thing that I wanted to mention is, I assume everyone here, or maybe not, you dual qualified as a therapist and hygienist, as am I, from New Zealand. However, I stopped practicing therapy as a therapist from I think I want to say 16, and I've not
Okay.
practiced therapist since then. I regret it. So I would say, so I'm actually currently trying to kind of get back into it. Well, I'm looking into it. So one thing I would say is, even though you might not enjoy, if you don't enjoy therapy as much, try to keep upskilled. Don't de-skill yourself. Like, utilize the full scope of your practice. Because you just never know. No, one day you might want to practice as a therapist again, and it's like, to me, there's one thing that I would say that I regret is not to keep up with my scopes that I was qualified for. And one last thing is, do not be afraid to ask for buffer times between appointments.
Mm,
especially when you are starting out. Please do not afraid to ask that from the practice. This is what I did with my first hygiene job. I said, look, I just, I'm going to run late, and well, I'm likely to run late. And if you just give me, for example, uh, one 15-minute break after 3 appointments, so that you have that buffer time to sort of, do your nose and sort of just, um, take a breather and so I think that kind of thing is helpful as well. Just don't, there's no harm asking, and if you feel like that's what you really need to, you should try to push for it.
mm.
Yeah, that's it from me.
Brilliant. Oh, some really, really useful points there. Yeah, particularly about the deal breaker. That is really important. Even in your early days, don't feel that you
Mhm.
need to just accept
Yeah.
anything. That's fine. Amy, did you have your hand up then?
Yeah, sorry. No, yeah, I was just gonna. I think Christina made some excellent points as well. I think looking at jobs, one of the main things that you want to do is newly qualified, someone that's just recently graduated, is who's going to support you. So the practice there that I started out, and I went back to the practice where dental nurse, and it was amazing because I could have an hour for my first patient if I wanted to. I could have those breaks, and I knew I knew the dentist and the hygienist that I could go up to during the day and, ask the questions. So yeah, ask who's going to mentor you in the practice, what support are you going to get when you first start out. I think that's really important.
Brilliant, thank you. We've got 4 minutes left. Oh, Amy, can you just choose some questions for us to blast through as much as possible? What I can do is for any questions that we don't answer, we can maybe look to answer them and email them out to participants. So you do get an answer for that. Although some of them, if it's more to do with the next webinar, then we'll try and cover them then. But are there anything relevant to today's, Amy?
Um,
Sorry, I just saw someone ask what's buffer time. It just means a break. Sorry, I just wanted to
Oh,
quickly put
oh
it. It just
yeah.
means a break, sort of, I don't know, maybe it's not the right word for it, but just to um yeah, do your notes and all that. So you have a basic break.
I think someone's asking red flags to look out for in a job advert. I think, what Christina was saying, it's what are your non-negotiables. So if there's something in the job advert that you definitely wouldn't negotiate on, you can still ask if they would change that. I've had it before where as a practice, actually, there was a job advert. I don't think it was in the job advert. I think I phoned up at a job advert and they said straight away there wouldn't be nurse support. And I said I would only want to take the position if there was nurse support. And then they did give me full nurse support. So always
okay.
ask as well. Um,
That's
what else have
useful
we got
to
on the
know.
list?
I was just going to say on that one as well, where it says, a forward-thinking practice with teamwork, and then it says no nurse. I'm like, okay, there's a bit of a red flag for me. That's a bit contradictory. So,
Yeah, but also have a chat with them, educate them, help, tell them why you need a nurse. So it's
yeah.
always good as well. There's another question here. Yeah, someone said, how do you ensure you always have a nurse to work with? I think you need to just have that discussion with the clinician, with the employee or with the practice manager or principal that you speak to. I've been a hygienist now for 13 years. And I've had some times when they've said the nurse is just pop into the post office, you'll be all right for one patient, won't you? And I point blank said, well, cancel the patient. I have found that colleagues that from the start accept these times when the nurses disappear, then it keeps happening to them. So
Yeah.
I've always stood my ground and says, well, I'm not treating anybody until my nurse is back in the room. So there's that sort of don't be afraid if that is what if you don't feel comfortable working without a nurse, then don't be afraid to say you're not going to treat a patient until you have one.
Yeah. And see
I
what's
mean,
in your contract as well. I would say get it in your contract. Whatever's in your contract, then, that would be the agreement.
Yeah. What else have we got here? Um, how often should you update and renew your DBS? Well, that's a good question actually, isn't it? Because you got the update surface. So let Emma answer this question actually. She'll be fresh on it.
Yeah, so I think obviously if you subscribe to the update service, then you don't need to update or refresh it. If you apply for new jobs and they ask for it, then you would need a new one. And I think that's a frustrating thing. Is I've been in a position before where I've had to apply for like three DBS at the same time, and it's just like a minor change in job title or something like that. I have heard that it's potentially every 3 years, or other things is as long as you are in that job. So if you've been in that practice for 10 years and you've still got that DBS, my honest answer to that is I don't 100% know, but that is something that we can find out. But that would probably more come down to the practice to be on top of for CQC. And that's where it's sometimes just beneficial to be part of that update service. So if they do keep asking you, you go, there's my number, and it's just done. And, the pain's taken out from there.
Yeah, definitely. Someone's asked roughly how long should different procedures take when newly qualified. I think that's totally dependent on yourselves. You know, see what time. I'd negotiate as much time as possible, and then bring and go from there, really. Um,
I'm just going to take the last couple of questions if you can, because we are on half past. But we will, try and get this. I'll have a chat with Sharon and see what the best way is of communicating, these out, so we can maybe just collate a Q&A sheet. But any final ones to finish with, Amy?
I think just as our practice is flexible when it comes to employment, self-employment, does it tend to be negotiable? I do think it is negotiable. I think, that could be a red flag of practices, some of them that won't negotiate at all. You might find with some of the corporates that they all follow the same sort of system. So they'll say, well, all of our hygienists are self-employed on 40%, and that's basically what it is. And you might find more with sort of corporates that you can't negotiate so much. But I think, a lot of the smaller independent practices, I'd say even, any practice, always have that discussion with them. But do your research beforehand. So, how much would you want to get employed? How much would you want to get self-employed? Look at all the things that Emma said, like how much the patients pay, and then just be ready with that information yourself.
Perfect. Well, I think there's a good place to leave it for now. I'm so sorry that we didn't get round to everybody's questions there, but thank you so much for your questions. Thank you for coming tonight and for giving your time for this. Thank you to Amy and Christina for giving your time, and Sharon as well. I know you're there in the background. So yes, our next webinar for part two for this is on the 16th. As I say, we will endeavour to get these questions answered and back to you. Within the next few weeks. We may wait and see what questions come from the next one, so we can just have one document that goes out, but we'll have a chat about that. If you've got any questions or feedback in the meantime, please do let us know. Amy, are you happy for, as part of your role of student rep, how that's communicated with you?
Yeah, you guys can email me. Any of the students can and newly qualified can email me at studentrep@bsdht.org.uk. So if there's any more questions that do come in, if you want to email me there. Also follow us on. We have a BSDHT student room on Facebook, and we have a BSDHT Instagram account for students as well. And we have our main account, so you can always send us DMs on there as well.
Perfect. Lovely. Thank you. Well, 3 minutes over. We didn't do too bad, but enjoy the rest of your evening, everybody. Thank you so much for being here, and we will see you again in a couple of weeks for part two.
Thanks, Emma.
Perfect.
Thank you very much. Bye bye.